A lot of our clients come to us having done traditional cognitive behavioral therapy, CBT, before, and they didn't get the results they wanted. They didn't get any meaningful change, and that can often put them off therapy for quite a while. And some of them end up with us, and I think we get great results. Some of them maybe never do. So what I wanted to do here is make a video and talk a bit about, if you've done traditional CBT for OCD, why it might not have worked and why you might need a better approach. So in traditional CBT, we get a worrying thought or an intrusive thought, and then we have a little debate with ourselves about whether it's true. So we might think, we have an intrusive thought like, I'm going to kill myself, and we start debating whether that's true. So let's look at the evidence for and let's look at the evidence against. The problem with doing this for OCD is that because these intrusive thoughts keep coming without being asked, then whenever we get into a debate with them, we're essentially fueling the OCD. Because OCD is a struggle with uncertainty. Like, we know that we're not going to kill ourselves, or that we're not a terrible person, or that we're not going to die from cancer tomorrow. But there's this tiny bit of uncertainty, and that's why we need to go do the checking, do the validating from other people, speak to a doctor, those kind of things. So whenever we get into a debate with our OCD, we're giving it that energy, we're feeding it, we're saying this is a legitimate concern to pay attention to, and then we're going to dismiss it ultimately because the evidence is stacked against it. But even just kind of giving it that legitimacy of saying, okay, I've had an intrusive thought that I'm going to kill myself. Should I give that any attention? Well, traditional CBT says yes. Let's look at the evidence for and against that. But as I've said several times already, that ends up fueling the OCD. So at the clinic, we use a different approach. We use an acceptance and commitment model, and we look at how you can disengage with those thoughts. So rather than even getting into it, how do you recognize it, label it as OCD, and just toss it away straight away so it doesn't take any of your energy? This avoids that process of kind of feeding and maintaining the OCD, because you learn a different way to interact with your intrusive thoughts, mostly how to not interact with them, and there's specific techniques we teach on how to do that. But the benefit of that is that rather than fueling the OCD as traditional CBT can do, you learn to disengage, to step away from the intrusive thought and all of the difficult emotions that it can bring when we let it in the door.